Hello, good evening. Welcome everyone to our information session today on health informatics and health services management. My name is Mushra Chaudhry and I am the manager of recruitment and sales for the Chang School. Before we get started, I'd like to acknowledge the land on which Toronto Metropolitan University is built upon. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. I thank the indigenous peoples of Turtle Island for their efforts to protect the land, and I deeply regret the past injustices they have endured. As Toronto Metropolitan University seeks to move forward in partnership with Indigenous peoples, I pledge to foster an environment that is more inclusive and welcoming of Indigenous peoples from all communities. Now, I'd like to go over a few items so you know how to participate in today's session. Your microphone is muted throughout the event so as not to disturb other attendees or the presenters. For the hearing impaired, we have automated captioning available, which you can access by activating it in the toolbar at the bottom of your screen. You can submit your questions for our speakers at any time by typing them into the question box in your control panel, and we'll collect them throughout the session and address them at the end of the presentation. Now, I'd like to briefly introduce our speakers for today. First, we have Dr. Priya Nipak, Associate Professor, Interim Director of the School of Health Service Management, and also an Academic Coordinator of the certificate. We have Lisa McKenzie, Director at the Canadian College and Alpha Health Information Management. And then we have Abba Zafar, who is specializing in clinical data science and augmented intelligence and clinical decision support system. And he has 20 years of experience in digital health, in clinical practice, and holds an MD and MPH and a master's in health informatics. And we'll hear from him as well. But before we do that and go into our presentation, I'd like to do a quick poll where we want to know what your goals and motivations are and what motivated you to consider taking this certificate. We have career advancement, career change, skill building for current role, personal interests, and others. So we'll leave that on for just a couple of seconds and share it out with you. Thank you for taking part in the poll because it gives a really good feedback to us that we can provide back to our team. And it's also a good way for our speakers to know what people are interested in today. All right, so I'm gonna go ahead and share the results. And career change and career advancement are the top ones, which is pretty consistent with our sessions before. And then we've got skill building for the current role and personal interest as well. So thank you for taking part in that. Now it's my pleasure to introduce our presenter, Dr. Priya Nepak, Associate Professor and the Interim Director of the School of Health Services Management, and also the Academic Coordinator of the certificate at Chang School. Welcome, Priya.
Welcome. Thank you so much, Mashur. Well, I noticed that almost 80% of you indicated that it's career advancement or career change. So this is the right place for you for sure. I'm thankful that you joined us, and hopefully this information will be helpful in making your final decisions. So as a start I will want to speak a little bit about both certificates and the structure of them. And the health informatics certificate is, and in some ways, you'll see that both the health informatics certificate and health services management certificate have similarities. The delivery for both of them is online, and it is 7 courses for both of them. It's 1 year in length, and the health services management certificate you can complete between 8 months and 1 year, depending on how you stack your courses and how they align with any prerequisite requirements. And the cost will vary slightly between the two of them with the it's anywhere between 4,100 and 5,300, depending on whether you're taking the health informatics certificate or the health services management one. So yeah, that's some quick facts. So in terms of industry trends, we do see that there are quite a significant amount of applications overlap between both the two fields, but then there are some things that are quite unique. For example, we absolutely know that both the healthcare system, which would serve the health services management stream of individuals, is changing rapidly. As to the field of health informatics has grown significantly with the evolution of and access to big data and how we're using that data. So there is a significant need right now for people who have expertise in the area of health informatics, or essentially analytics within the field of healthcare. And in addition, there is quite a significant, and which then leads to obviously people who are specialists in data analytics and policy, privacy, and security, because increased privatization of healthcare is also another huge area and sector that's continuing to evolve. And we're seeing quite a few people enter the industry in that capacity where there is a significant need for managers who understand the healthcare system, but as first, they want them to be trained as managers. And that is the benefit of having our health and services management certificate, where while it's giving you context specific content, it is largely emphasizing management within that system and understanding management requirements within that system versus the health informatics certificate, which is all applications, or let's put it this way, largely related to analytics and privacy, security. So some of the applications that you will be able to interact with if you sign up and take the certificate would be AI applications to predict and prevent disease, data analytics, cybersecurity, interoperability, genomics, virtual reality. There are innumerable applications because it's limitless now with the evolution of AI. There are so many different tools and applications, and I'm hoping that today you'll learn a little bit more about that as well from Dr. Zaver when he speaks further. The applications of health services management, there's quite a significant number of those as well too. In areas of policy, accreditation is quite significant, evaluation and quality improvement, human resources, financial management, ethics, to name just a few. But you will understand that within that context, there are quite a broad number, and these are all management areas specific to healthcare. So that's kind of the overarching theme there. Thanks, for sure. So what you're going to learn. So towards the left is largely focused on the things that you'll learn in the health informatics certificate. And then towards the right is what you would be learning in the health services management certificate. But remember, and while I can get into this in greater depth when we have the question and answer period, there are four core course requirements for both certificates. Well, four for the HI, five for the health services management. You do have elective options in both of the certificates, and those elective options might actually be drawn from the health services management certificate. Whereas if you're taking the health informatics certificate, you might be drawing your electives from the health services management certificate. I think I just said the reverse or the same thing, but essentially you can take your electives from the opposing certificate. So there is going to be some overlap, or your ability to specialize in an area that you enjoy that could be similar or aligned with the other certificate. So in what you'll learn mostly in the health informatics one is foundational concepts and applications in the field of health informatics, computers and networks, information systems and design, interoperability, human factor impact, information systems in hospitals and community care, a lot about virtual care and care applications. The thing of it is that some of these are actually boiling down to specific courses on their own, but many of these will be seen across the various different courses in the health informatics certificate. Whereas in the health services management certificate, you're focusing more on things to the right, like consumer and public health informatics, healthcare systems, the electronic health records, machine learning and AI, trends in the field, management principles, human resources management, ethics, privacy, and security will be sort of the areas of focus. But like I said, they overlap quite significantly. So you're going to see that you have opportunities to learn both, essentially, depending on what you select for your electives in those programs. Yes, thanks, for sure. So career paths and options, given what we just learned from the poll. These would be very relevant. And what this is boiled down to in terms of job titles that are searchable. So essentially, there are many different career paths defined by many different titles, but these are ones that are easily searchable so that you can see that they're aligned with the requirements that you will be getting when you complete those certificates. So in health informatics, there are things like decision support analysts, clinical information analysts, clinical informatics specialists, quality improvement specialists, health informatics analyst, health data analyst, medical informatics analyst, analytics manager. There's also within the field, there's nursing informatics, and so nursing informatics titles as well too. Health services management, on the other hand, you're going to see things like executive director, mental health lead, operations management lead, healthcare manager lead, patient safety consultants, as well as leads, depending on the hospital, quality improvement managers, screening managers, and basically every clinical area and operational area will have managers associated with them. So, and all of those would be eligible pathways. Thanks so much. So, I guess this brings me to the last slide that we are ready, like we're accepting applicants for the winter term. And you can submit now by going to our websites. And I think Mashur is going to give you a little bit more details about that. Yep. And then also too, I think this is where we're going to open up the floor so you can ask further questions because I'm sure you have them and we're here to help.
Yep. So but just before we do our questions, we'll quickly have a couple of messages from our two other speakers. So next, I wanted to introduce Lisa McKenzie, Director of Canadian College of Health Information Management, and a passionate advocate and champion of health information management professionals.
Thanks so much, Mr. Well, I'm delighted to join you here today. Probably should have had it in my introduction there as well. I'm a proud alumnus of the Bachelor of Health Administration program with Toronto Metropolitan University. So I'm very familiar with a lot of the courses that are in these course certificates. I completed them myself, and they're definitely really valuable in helping you advance your career. So can't say enough about the great way that this information is provided to you through this course. And I said we did see a lot of you are looking for career advancement and career change. I was a full-time employee when I did my program as well, and that was one of the key benefits that I found of the course for sure was being able to do it remotely and mostly on my own time. So that's a huge benefit. In terms of informatics broadly, we are seeing a lot of emerging trends in health informatics. We're seeing huge focus on connected care for Canadians. While we didn't have our legislation pass, unfortunately, because earlier this year when government got prorogued, it died, but we're hoping that it will get revamped and brought back. And it is so important, though, that we have connected care for people in Canada to make sure that they're getting the most effective and safe care that they can get. So all of that to say, health informatics is what's going to drive all of that. You can't do that connection of providing connected care information without people who are skilled in informatics. So a huge need for it. There's going to be an increase in this definitely happening over the next number of years. We're seeing a lot more focus on electronic type of digital health type tools. So anything that we can do to help support the health system with those types of very skilled, competent professionals doing that work, I think that's what's going to be really important and one of the huge benefits of these two certificates. So just a few thoughts from me, Mashur. I'm not sure if you want to pass it along again now.
Yes, thank you so much for sharing that. I love that bit about connected care. It really shows the potential that's possible right now in that sector. So thanks for sharing that information. And now I'm delighted to introduce our next guest speaker, Dr. Abbas Zafar. Abbas is a physician and digital health leader with over 20 years of experience spanning clinical practice, health informatics, and digital health transformation. He holds an MD, an MPH, and a master's in health informatics from U of T, specializing in clinical data science, augmented intelligence, and clinical decision support system, and is a strong advocate for personalized medicine as well. Thank you, Abbas, for joining. I know you are traveling, so really appreciate you joining from there. And if you'd like to say a few words for our attendees.
Can you hear me?
Yes. Yep,
Okay,
you're good.
great. Okay. Hello, everyone. This is a great. So I have been in the same shoes in this program, starting my new alternative pathway in Canada with medical background. So because based on my research at that time when I came to Canada with several reasons, I found this is the perfect alternative pathway for even people with clinical background. They can apply easily their clinical in this digital environment as all the anywhere specific system they are digitizing. That would be a perfect in the other points, this is a growing market, health informatics and digital health. Even in the pandemic time, many markets, they have issues, but the health informatics and digital health growed very well at that time. So that would be the future, specifically implementing more digital health solution and AI-enabled solution. So yeah, that's the way I can recommend to anyone else, as I have been recommended by Priya then the first year when I came to Kenya.
Yeah.
That's brilliant. Thank you so much
I'm
for
not sure if
sharing
our
that. Yeah, go
listeners
ahead.
thought or that Abbas was a graduate of our health informatics certificate early in the inception of our program, and so he's been working with us since then, and actually has taken on significant leadership roles as well too, both here and at University of Toronto. But he is currently in the stages of developing a new AI and precision medicine course that will be added to the elective options for students in the health informatics program as of summer 2026. So that's very exciting, and also speaks to the fact that the certificate is continually, both certificates are continually being updated to reflect the changing trends. Yeah.
Thank you for adding that in, Priya. Yeah, that's really great to know about the new course that's being developed. It's really exciting with AI just everywhere now. That's really good to hear that we have someone like Abbas developing that. So that ends our presentation portion. We will now open up the Q&As, and as you can see, we've got lots of questions coming in. Thank you everyone for putting in your questions, and we'll go over them. So let's just dive right in. The first one. What is the difference between the two certificates, main difference, I guess, between health services management and information management? So I'm guessing between the services one and informatics.
So I can take this one. So if you look at the core course offerings, you'll see that most of and all of the health informatics core course offerings are exclusively focused on health informatics, whereas the principal focus for the health services management certificate is largely on developing and learning management skills. The initial development of the health services management certificate was largely tied to an understanding that many people who are working clinically in the healthcare field eventually want to ladder into management positions, but sort of lack the acumen and the competencies to do so effectively. So then they come in, they do our health services management certificate because it is entirely focused on developing those skills because during their initial training, they would not have had an opportunity to interact with content like that. So that was the large, whereas with the health informatics certificate, the goal was an understanding that we were evolving in terms of our use of health records and how we were able to interact with health information in the way that we were gathering large amounts of data. And in fact, our interoperability with both at a provincial or interprovincial and then provincial and national level was growing considerably. And what we could do with this data in terms of improving healthcare operations and programs just exploded. And alongside that was an understanding that people need expertise in this area to be able to manage this evolution of data and what we can do with it.
Awesome. Thank you. Thanks for adding that. And a really comprehensive answer. Anything Lisa or Abbas want to add to that? Okay. Yeah, we can move on to the next one. So we have a lot of IMGs, I think, that are attending this session round, and they want to know, if they are an IMG getting into the sector here, is this a good certificate to take, and if they can join it?
Yes, they can definitely join it. And yes, it has been a very beneficial certificate, particularly for IMGs, because you are able to leverage your original training and then enter the sector because you have additional competencies that are specific to our healthcare system. One thing for sure, while you obviously have the clinical understanding, particularly IMGs would have a clinical understanding. Our system, publicly funded and all, is quite unique. And people in other publicly funded systems will still come to us and say, wow, you guys are very unique. So you will learn about the system specificity at both a national and a provincial level, which you will come to know that it is quite different from province to province in terms of the delivery of healthcare because it's left to each province to oversee. And so it is really important to even, I mean, the health services management certificate would be a great addition for an IMG as well, too. So yes, keeping that in mind.
Brilliant. Thank you for that answer, Priya. Okay, so moving on, just checking if there's anything else. Please let me know if Lisa or Abbas you want to chime in.
Yeah, I just want to say something
Yeah, go ahead.
as I'm IMG as well. So those people who are looking for alternative pathway, this is was the reason I selected health informatics for my alternative career, as there are more opportunity for that. Consider any other alternative career pathway for IMGs as a research or optometrist or any other alternative. You will find there are really limited option of positions. But for health informatics, Priya reviewed some of those opportunities, but based on my analysis at that time and recently, I found a big list of different positions as the location of opportunities broad for health informatics is hospitals, primary care, community care, laboratories, pharmacy, research, consulting, a startup company, innovation. So there are many opportunity for that, and that would be great as alternative pathway for IMGs.
Thank you so much for adding that. Yes, lovely to hear. It's a big population of people that are now interested in this sector, are IMG. So the fact that they have that alternative pathway and coming from you, it's great to know. Lisa, go ahead.
Thanks. I just wanted to add that one of the things that we saw in a very broad scale during the COVID-19 pandemic and coming out of that was that we have a lot of very skilled people across the country who know a lot about health, but don't really understand health information and health data. And that's what informatics really is. It's really helping you to get that health data literacy that really helps you understand not just the health part of it, but the information part of it. So that's why this is such a valuable certificate to get. And again, I'll just put the plug in. Once you get this certificate, you're part way to getting, if you wanted to get certified, you can do the BHA program with Toronto Metropolitan, and they are an accredited program for you to become certified in health information management as well. So it's really that foundation that gives people that skill around health information literacy that's so important.
Thank you. Yeah, that's great for you to mention that pathway that's there, that's possible for all of our attendees. Now, we're getting a lot of people asking questions about, coming from different backgrounds, and they're not sure if the background that they have it's going to help with this. So I'll combine a bunch of backgrounds so that we can get to more questions. The first one is somebody who has a background in customer service. So they're a customer service manager. Ayan Bashir, thank you for your question. And then we have Opie Anif, who is also a transitioning from dental. And then we have somebody who is coming from masters in public health and wanting to know if they can take the HSM certificate. So, if you can touch a little bit on those different backgrounds and how that fare with this certificate.
Yeah, so all of those people are describing either clinical experience or management experience. And so in their original fields, or a mixture of both in the case of the Masters of Public Health. And so what you will find is that either or of these certificates will be beneficial in leveraging your capacity to be able to enter, say, healthcare. So for somebody who was originally in the customer services realm. I would also say that it would be beneficial if you want to take the pathway that Lisa's described and go even further to getting a degree in this field after you getting this certificate or either or certificate. You would definitely want to start to seek out opportunities to volunteer within the sector because it is also necessary, the experiential component combined with the certificate, which will give you the ability to sit first upon completion of the health informatics certificate for a designation that is recognized across Canada, a national designation of health information. Oh my gosh, it's a long name. The Canadian Health Information Management Systems Specialist, is it? Oh my goodness. I hope I'm doing this justice through Digital Health Canada. Lisa might want to take over. Sorry, Lisa. I was close. It was close. And it is a recognized designation at a national level. Not obviously as recognized as a CHIM designation, that's for sure, because that is kind of the premier Cadillac version, but both of them are well recognized, are recognized certifications. And I think I'd have to point to the fact that if you're transitioning into healthcare, both experience in the field is a very, very beneficial thing, whether that comes by volunteer or work experience. And then the other thing that's extremely beneficial is working towards particular designations or certifications, because those are very well recognized in healthcare. So what you want to do is make yourself, as let's put it this way, easy enough to grab by mirroring what other people who have been able to successfully gain employment in those sectors. And those are two things that I know definitely make the difference. And I don't know if Lisa or Abbas want to chime in and add anything else, but
Yeah, I want to add, as I said, health informatics, digital health, health information management, they are very overlapping and they make a very broad environment in healthcare system. So everybody with any background can find their position in this broad spectrum. In development, we need lots of people with technical background, coding, developing. Then for implementation, we need change management, implementation, project management. Then for delivery, customer service, and other delivery expertise for analytics, for decision making, for any of those, this roadmap is welcoming for everybody with different background. You just need to transfer your skills from that background, apply it in this new environment.
Thank you. Thanks for adding that. And since we've started talking about this answer, we've got a bunch of people putting in more different backgrounds, like marketing and sales. I think someone is a medical clinic administrator. So yeah, thank you. I think it applies to pretty much a lot of these professions.
Marketing and sales, I actually just want to chime in. We're currently in the early stages of developing a marketing course in healthcare for our degree completion program and our new, very soon to launch undergraduate program. And it is an area that is growing so rapidly in the private sector. Some of you might even have seen, you turn on your television and you're going to see that there are ads now for, whole body MRIs, the one I see all the time, no matter what I'm watching. And that is a private company where you can go get yourself scanned from head to toe. We also see this, let's put it this way, steady state in the dental industry because there are people that are marketing broader and wider and in many different creative ways. But this is definitely a sector that is going to grow as well, too. So don't be shy if you have a marketing background. You also will find employment opportunities once you're able to learn about the healthcare context. So, yeah.
Awesome. Thank you. So I'm moving right along to, we have a bunch of people that asked a question about if they qualify for CHIMA after they take this course and if they can take that exam.
You can hop
Yeah,
in
go
there if
ahead.
you'd like. So the accredited program that it makes you eligible to write the CHIM National Certification Exam is the Toronto Metropolitan University Bachelor of Health Administration. However, that course, that program, that degree program is largely built on many of the courses that you'll do from the certificate. So, and Priya, you can certainly speak to the pathways, but you could, when I did my program, there were lots of people in my classes that were in the certificate stream and some were in the degree stream. So, you can actually decide which way makes the most sense for you. It's sometimes it's a great way to kind of come in, decide if it's what you want to commit to, and then move on to the degree program. Maybe you only just want the certificate. But if you do want to get the CHIM certification, you do have to complete the bachelor program. And I did see one question from somebody who lives in Newfoundland and Labrador. I'm also in Newfoundland and Labrador, and yes, you can do your program from there for sure, because I did it. I did the whole program here. So thanks. I'll pass it over to you, Priya, if you want to add anything there.
Yeah, just that Lisa's correct that we see the Bachelor's of Health Administration program that Lisa is referencing, which is she's also a graduate from, and did it from Newfoundland and successfully, I can attest to. You can take this certificate, which is either of these certificates, because both of the core and many of the electives, assuming that you select them from the health services management or health information management stream, or in this case, health informatics stream, as long as you're drawing them from our program area, all of them will be able to come and be used towards the degree completion program. If your goal is to get the to become CHIMA certified and get the CHIM designation. So if that is your goal, the certificate won't allow you to reach that goal, but using all of the courses in the certificate towards the degree completion program will allow you to do that. The degree completion program will operate just like the certificates, fully online with synchronous teaching opportunities to engage with your peers and your instructor. And as well too, like all of these courses are packaged in that you can take more than one per semester, but they're intended to be taken by people who are working full time as well. So that's important. And I think Lisa has actually indicated that a couple of times. It's the only reason why many people are able to take our program is because it is actually in a flexible enough format that allows you to work full time and take courses. So
Okay, awesome. Thank you. Thanks for sharing that. Next is Priya, can you elaborate on assessments and exams being online?
Yeah, so all exams and all assessments will be online, and all of your assignments, your group work, everything is going to be done virtually. So there's group work designated times where groups will work together synchronously, but everything is done virtually. And so people are able to work from their homes no matter where they are. All your assessments are uploaded to the course, the online course. And so everything is marked. All of your instructor engagement, your lectures, any engagement with the content, with the course and the content is going to be online and virtual, and there will be synchronous components in every single one of your courses, whether you take the health informatics certificate or the health services management certificate. That has been a recent update to our programming in the last 2 years. So there's live lectures. Some people are using it as drop-in group work session, but every single week there is synchronous engagement with the instructor and your peers, in addition to a number of asynchronous ways that you can engage with your peers as well too.
Brilliant. Thank you again for that answer, Priya. Now, next is, people want to know about the experience, the experience that they're going to get with the certificate. So if there is any co-ops or any labs, anything hands-on during the certificate, and if somebody doesn't have any medical background or any technical background, is this something that they can take? So maybe everybody can touch on that a little bit. I know Abbas has taken it in the past as well, so maybe you can touch on that as well.
Yeah, so I think we might have lost a boss for a quick second, but hopefully he will get back in because he actually would be able to speak to this most fully in one specific course, which is the Foundations Health Informatics course that you will take in the Health Informatics certificate. And you could also potentially take as an elective if you were taking the Health Services Management certificate, because there are opportunities for exactly what you're saying. In terms of simulation based, there is also live simulation in the management cycle course. There are many opportunities, there's case studies and case analysis that will happen right from your healthcare systems, the foundation course that is common to both certificates. It's a deep case study analysis. It's done in group settings, but there is absolutely no placement, like live placement opportunity in either one of the certificates. So we've tried to embed as many opportunities for students to engage in simulation and exercises that will allow them to mimic what they would be doing in a real world healthcare setting because we do not have an actual placement within the certificate. So, and I don't think we got a boss back because he actually teaches our Health Informatics Foundations course, CHIM 305. It recently went under redevelopment, and he's also currently developing the AI and Precision Medicine course, which there is a small portion of that embedded in the Health Informatics Foundations course, a module essentially of your 12 modules that you'll go through and other relevant AI applications in the field. So it's just been newly updated. It is fresh, 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 like fresh 2025 fresh because it was just redeveloped this past semester and it's running in its revised form this fall. So yeah.
Yeah, it's a field that constantly keeps evolving and changing, so you got to keep updating. So it's good to know that it's,
And that was a conversation we had on Tuesday. I've said, well, what are we doing for redevelopment? And I said, we're going to be doing redevelopment every single year because this is an area where it is constantly evolving and there'll be a requirement to keep updating everything so that students are getting the most accurate and relevant information. So, yeah.
yeah, absolutely. And I know we lost his connection and hopefully he'll return, but if he doesn't, I just want everybody that's attending to know that we will be following up with all of you individually. So if there's anything that is not answered or you would like a specific answer from one of our speakers, let me know and I'll be your point of contact directly to get every answer to you. That is our commitment. So moving on to the next question, let's go to a different direction for this one is someone wants to know if this certificate will help them with clinical research and regulatory affairs.
So clinical research for sure, because that's just one facet of the type of data that you can interact with and actually leverage for the purposes of for research. Like Abbas had mentioned earlier, there are many ways that you can use this data for decision-making purposes, programming, quality improvement. Within the healthcare system, there are many ways that data can be used, and research is one of those, and clinical research is one of those. And so that's kind of a more traditional way that we've typically tended to gather data. So definitely you would be learning, and I would suggest that if that's an area that you want to get into, that you would take your electives where you would have an opportunity to specialize in analytics, because there are very advanced data analytics that and courses that you can have access to at TMU. And I would say specialize in those because we have a foundations course which allows you to interact with many types of health data and complete analysis, but this will allow you to do advanced modeling and learn those techniques so you can effectively work in that environment.
Great.
Yeah.
Okay, next question is there a focus about health informatics and its context with racism and understanding biases that still occur in the marketplace today? Historical bias, ratio circulate calculations, etc.
Yeah, so I would say that we have the human interactions course, which I think is really great with addressing bias. Every single course, because of our pillars that are, Lisa had said earlier, all of our courses are tied to a degree. And so it is definitely something that bias, and let's put it this way, components of EDI are really related, or let's put it this way, linked to every single one of our courses. So there is some degree of exploration that will vary from one course to another. Bias and influence and let's put it this way, race related linkages to healthcare. It's covered in the health informatics, sorry, the health care systems foundations course. You will see it again, obviously, in the foundations health informatics course that Abbas teaches as well too, because we're looking at let's put it this way, he speaks about building the system where we're actually starting to identify those particular attributes, which for the longest while at a national level we weren't doing that. And so provincially, many hospitals have pushed forward. Statistics Canada is starting to generate that data, but it's kind of a first step because we really can't get a really clear sense of what is happening in relation to those particular demographic factors without it. And so it's kind of first, as a boss would say, you have to build the system and the infrastructure to collect the data to then examine that phenomenon. But at a site-specific level, we are seeing some evolution. There are case studies that are explored, like I said, in the healthcare systems course. And we definitely know from the standpoint, because we have been connecting indigeneity status for quite some time, we have a better understanding. And some systems are far more advanced than others. So Cancer Care Canada, I think it's CCC, CCO. We also have Cancer Care Ontario that also is doing collection of these particular types of race-based data that we had not seen before. So there are some systems that are very advanced and others that are slowly moving along, trudging along. Yes,
Great. Thank you. Thanks
we're
for
building
that.
the framework.
Yeah, building the framework step by step. Okay, so just to taking a look at time, where we just have 2 minutes left in our official. Is it okay? Do you mind staying a couple of more minutes because we still have a few more questions and we'd like to get through? Is that okay if we go a few more minutes over? Lisa, is that okay with you? Awesome, cool. So I know this is a big topic all the time about getting into the workforce after this certificate. So, what are job prospects like? What is the pathway like? And then, we're getting more questions about the background, right? Do I need a specific background to get into this certificate if someone wants to get into the workforce after that? So, yeah, if you can both touch on that a little bit.
Yeah, so there's some degree of flexibility. Abbas had mentioned this earlier as well too, and spoke about the various different pathways for IMGs. But depending on your background, which can vary considerably, that background would be specific to what I would, let's put it this way, advise in terms of what you should take and how you should package your courses. So it is relevant background for sure, but in the most, it shouldn't be or considered a limitation to your ability to pursue this certificate. It just might mean that if you have zero healthcare background, that you're going to have to do a lot more investigation, or let's put it this way, build your CV to reflect that you have the experience. Uh, and that might be some volunteer opportunities or trying to demonstrate that you have the skills as they relate to what is required in a healthcare environment. And that might be a little bit trickier. We do have supports as well too for job seeking. I think Abbas is going. I think Mashwar is probably going to share those with you at some point in time. But we do have career advisors as well, who are on hand because it's difficult for me. Typically, let's put it this way, our health services management certificate, like I said, was largely developed, intended for a clinical audience. But having said that, people who are entering, innovation, entrepreneurship, those people have come from other sectors and they've done quite well with our health services management certificate. So that's why I don't want to now put a full stop. Never mind the fact that you project management, all of these areas have application in other sectors that you can translate, or let's put it this way, transition into a healthcare environment quite effectively. So both certificates will allow you to develop new skills, but then also to, I think it's really significant in terms of job seeking that you're able to demonstrate that you can leverage your pre-existing experience and education towards employment in that sector. So I don't know, Lisa, you probably have something to add. I see you shaking your head, so
No, I'm agreeing with everything you're saying, but absolutely. I mean, we're always the whole healthcare sector across Canada, whether it's private or public, everybody is moving to these electronic health systems. We're digitizing at breakneck speed, and we're doing it in a lot of cases with people who are learning it as they're going. So they're always looking for people who are coming in with those types of skills, and they've shown that they have those types of skills by completing these types of certificates and later on certifications. So it's those types of things that will actually set you above. So, if you're a hiring manager and your choice is somebody who's, you've got two maybe registered nurses, we'll say, one's got an informatics certificate and the other one doesn't. They're likely going to pick the one with the informatics certificate simply just based on those criteria alone, right? So it will not guarantee you work, obviously, but it can certainly give you that additional edge that you may not have without it.
Brilliant. Yeah, that makes a huge difference that you guys mentioned that. So thank you for that answer. Now, lots of questions about nurses who are interested in this certificate and want to move from bedside to health management or into something else that's more informatics or management related. Would that be a suitable step for them?
definitely. It is a very suitable step for them. It would be the natural evolution that you would be doing a postgraduate certificate with your nursing, and it would allow you to transition into that sector. The field of nursing informatics has grown exponentially in the past 5 years, which is just a testament to what Lisa said, that we're moving so fast in terms of our building of our infrastructure of electronic health records. And so, and just transitioning away from paper, going paperless entirely across the country from, city centers to rural healthcare settings. And yeah, so nursing informatics has just been an explosive field. I cannot say without doubt that I feel extremely confident telling you, if you're a nurse, that our certificate would be an extremely great addition and add significant value to your career transition. So, yeah.
Hey, thank you. Thanks.
Although I
We
don't want to take nurses away from the bedside either, though. So I really don't. And I thank you so
they
much
are
for all of
needed
your
there as
continual
well.
service. It's
Absolutely.
like we recognize so much what nurses did during the pandemic, but they were doing it before, and hopefully they'll continue to do it afterwards. But yes.
That's right.
So next question is, Um, will there be any research opportunities with professors in the health informatics certificate program?
So there have been in past in the past our students we have collaborated with graduates of our program, particularly from our BHA, but nonetheless we have collaborated. Abus can attest to that as a certificate student on research initiatives, so that there is no limit. It's not a requirement, but it is something that if you're interested in considering, I would suggest that you reach out to our faculty and do that on a one-to-one because we don't prohibit it. You will learn and engage in a couple of courses with active research that certain faculty members are currently engaging in. But it is not something that's built into the certificates per se, but it's not something that we haven't seen happen. I don't know if that's a solid enough answer for you, but it's definitely not a no. So I don't know if I think that's it for that one, like in terms of research, but I don't know much more that I can add to that, but we all have, I mean, you can go to our certificate website. You'll see when you're enrolling who is teaching you. You can go to our BHA's faculty website. You'll see the host of all of our faculty that are associated with both of our certificates. As Lisa said, the courses are drawn from that degree completion program. And so if you're able to visit the BHA website, you will be able to see the host of faculty and what we're doing. So, yeah.
Now this one I don't really understand the acronym, so maybe you will help me out. Is someone saying I'm currently a CI at LHSC? Would this course be worthwhile for me if I'm already in the role?
Yeah,
So
so that
I,
sounds like they're a clinical informatician, maybe,
yeah,
in clinical informatics at London Health Sciences.
sciences,
So,
yeah.
yeah, I think that's where we are. And anything that you're doing in your role that helps you do your role better is going to help you. Absolutely. Anything that shows that you have those skills, that's another way that will help you because you can get the experience by being in the role. That doesn't mean that you actually have all of the skills that you maybe need. And it's just another way that can help round out your skills and make you maybe even just for professional development and growth, if nothing else.
Yeah. And you are eligible to sit for the Digital Health Canada certification upon completion, which is again a certification that you are eligible to obtain upon completion of the health informatics certificate. And like we've said, you could also use these courses towards your achievement designation as well too, if you ladder it up with additional courses. So
Right.
yes,
No, we are way over time, but this is the last question we're gonna do. And after I say the question, we'll just put one final poll up while you all answer. It's what type of volunteering would you recommend for people that are, looking to get involved?
oh my, it depends on the sector, right? So if the private healthcare sector will have different opportunities than the public healthcare sector in terms of volunteering. And also too, I don't want to pigeonhole it because typically when you engage and demonstrate interest, it's quite a long process and you do have to go through a number of checks as if you were an employee because it is a contract that you are engaging in with the healthcare institution, and because you are interacting potentially with patients or at least vulnerable people, there are a number of other checks that have to be completed. So what I say in knowing that is that those organizations will have roles that they designate. So it's not so much that you can enter the volunteer sphere in the healthcare system and then sort of self-select. Maybe in the private sector, because they do too as well need volunteers. But I mean, the idea is that even a volunteer position where you are doing something that's very solidly patient engagement, uh, it would be useful because you're still learning how things operate. And so you're still getting exposure to the environment. And it doesn't preclude you from opportunities because once you're enrolled with the organization, even as a volunteer, you can apply internally for jobs that are not posted externally. So that has actually been a pathway that's been very successful for many of my graduates that started volunteering and then were able to get jobs because oftentimes in the hospital sector they don't post them publicly, they're posted internally, and then you
Right.
can move from a volunteer position to a paid one. Sorry, Lisa.
Nope, I was just saying that right on. That's exactly the way that a lot of people get into the healthcare system. So any type of volunteering that gives you any exposure to healthcare patients, as well as the actual systems, that kind of stuff's going to be very valuable to you.
Yeah. And actually a requirement for every single type of designation or certification that you can demonstrate that you've had engagement with the sector. So
That's right.
yeah, so it's a
So
start no matter what.
thank you so much for that. We don't have any more open questions. We've had over 100 people attend today and over 70 people asking questions. So this was an amazing session. I just want to say thank you to our speakers and presenters for taking the time out of your day, and thank you to everyone else for attending our session. If you're interested to learn more about any of the certificates presented, please visit our website at continuing.torontomu.ca. And you see my contact information in the chat there, mashroor.chaudhry@torontomu.ca. All of this information and a recording of the session will be sent to you via a follow-up email within the next 24 to 48 hours. And on behalf of the Chang School and all of our presenters and speakers, thank you for joining us today. Have a great rest of the day. Bye, everyone.
Folks.